what you feel that our roles, the challenges of our roles are when we're talking about end of life dementia care.
Yeah, that's an interesting question, isn't it, Debbie? I mean, obviously, as nurses, as we all nurse, and we've developed those skills and abilities to talk about death and dying, it still can be very difficult conversation sometimes. And I think it's only through perhaps experience and training, and also how you feel personally about death and dying gives you that ability to open up the conversations to other people and their families. I always find it really interesting because it's the one and only thing in life that we know is going to happen to every single one of us, yet we choose not to talk about it. I think society has led us alongside medicine down a path where it's often hidden. Our expectations, the public expectations in society with medicine is that we all live forever, and obviously people are living longer with a lot more chronic illnesses. So that in itself makes it very difficult for people to think about death and dying, and what their wishes and preferences may be. Also, I think a lot of people don't experience death and dying within their own personal lives until quite late on, because of perhaps they haven't had a loved one die for many years. So there's a lot of factors that are contributing to the difficulties in talking to someone about death and dying, alongside people's own experiences, whether it be on a personal level or a professional level as well.
I think you're right, and I think even for people that work in end of life care, every death is as unique as people are, and I think we have to remember that what we might feel has been a good death, family members might perceive that in a different way. So that's something that we really do need to make sure we remember, that it's a unique experience for that person, isn't it?
And to highlight as well that actually we have medicalized death and dying, whereas it's a very human experience that all of us encounter at some point in our life's journey. So whether you're a professional or a human being, an individual, it's very important that we have those conversations. I think if you don't feel comfortable within yourself having the conversation, then it's important that you either ask someone who you think may be able to help you with that, or to perhaps to even access some further training in that area of your work. But I think one of the key things is, and I don't know what you think, Rachel, is, that I often reassure families that talking about it isn't actually going to make it happen any quicker, and that can sometimes put them a little bit more at ease about exploring their thoughts and feelings on it.
Yeah, absolutely. And I suppose myself, and working as a hospice Admiral nurse, having these conversations as part of that palliative care assessment, so sort of looking and exploring about, towards the end of life for somebody, what care and treatments are we providing, what matters most to this person and their families, and that's the really important factor, isn't it, that we do. However, I think in thinking about what makes good end of life care, for that person and their family is actually having those conversations probably a lot earlier on in the trajectory, because I think sadly, as we know, people living with dementia, their mental capacity is affected quite early on, and therefore I think using the process of advanced care planning is a way that we can capture really important information on preferences and choices for that person. And I think, you know, we need to think about probably the opportunities that allow people to start thinking about what is important to them. Is this something that they do want to engage in? Is there things that really matter to them at a time when they're not able to express those things, or to kind of take some of that decision making of families in a way that, because the discussions have already been had prior to somebody approaching the end of their life? Because I think otherwise there's a huge risk that if this isn't done, if these conversations are not had in a very supportive way, we've never offered it, then it can certainly impact on that care, and it not being person-centered, it not being around what really that person would want. So I think it can be really, really helpful to have discussions with somebody living with a dementia diagnosis, as you know, and supporting the families around what they may expect as that disease progresses. Although we don't have a crystal ball necessarily, I think if we can have some kind of conversations about what may happen, what could occur, then I think we, in some way, it allows us to engage conversations that get people to think and plan ahead to a certain degree. And I think that would be a really important thing to consider about where in our sort of roles, or where our contact with people, you don't have to take that person from A to C, do you? But it might just be A to B. But just being really mindful, I guess, that capturing for that person the things that are really important and value to their life matter now, but they're also going to matter at a time when they become less well, and they might still really be important things. So I think that would be something that is a challenge, but an important one that we kind of think about, really. Where do we have these supportive conversations with somebody living with dementia and their families? Because I think, as I said before, I think otherwise we get to a point where decisions are having to be made on behalf of that person without really knowing, and then that burden in a way lies with families or formal care providers. So I think it's really important that we think about that triadic relationship that we have with the person living with dementia and their families, and, you know, family carers or formal carers, and how we all kind of work together to capture those preferences and choices around decision making towards the end of life for somebody.
And I think anybody can initiate those conversations that know the person well. You know, advanced care planning can sometimes feel a little bit like it's everybody and then becomes nobody's responsibility and business. So people that know the person well can start initiating those conversations. And like you said, Rachel, it may be that you then hand on to the next person that you've done the A to B, and then somebody else might need to have more challenging conversations. But I don't think any of us should shy away, any health and social care person should shy away from initiating those conversations if it's the right time for that person. And I think, picking up on what you were just saying, Rachel, about carers, not having to know what they wanted and what they wouldn't have wanted puts a lot of burden on the carer. And I think when we talk and think about supporting the person with dementia, certainly at end of life, we must, you know, the carers are really, really important. But also when we're talking about future care, thinking about a contingency plan for the carers. So, you know, they're under an awful lot of strain, but what happens if you're not as well as you are today to continue that care? You know, who would do that in the absence of yourself? I think that's really important as well, and that's an important aspect of any end of life care, is to support the family as well as the person. So you know, we do need to consider the whole family as well. One thing I was going to ask is, what do you feel that families value most about the support that we give?
I think from my experience as a professional and on a personal level, I think it's about someone showing interest and wanting to listen. Listening being the key communication skill, being very attentive in their listening, giving you the time in a right way, in the right environment, and just being supportive in whatever it is that you're saying, you know, irrespective of their own thoughts and feelings that they may have.
I think,
Because I don't know about you, but sometimes people, family carers, have actually said, this is the first time I've been able to speak about the person with dementia as a whole person, because as people get older, you know, most people do and can live with comorbidities and multimorbidities. So some people just see that aspect of that illness and condition or disease and forget that there is a person as well. So sometimes families have said, this is the first time somebody's seen the person as a whole being rather than just that particular speciality.
I think for me, some families, it's about how we can provide that advice and support as to what's happening and what's going on, and giving that sort of information and knowledge to families to help them understand what's happening, how the dementia is affecting their loved one in the now, but also thinking about how things may change, because what I hear is that those conversations haven't really been had. And I think that's why I always think, actually, yeah, we should be talking about the whole like you've just said. I agree absolutely with everything you've just said about the whole person. I think having that sort of understanding about dementia as a disease, but who is the person that's living with this condition, because everybody is going to be so different, and the way the families are able to live with the condition as well is going to be different. So yeah, I think actually a value is the advice and the support and the guidance that we can provide throughout that trajectory.
Yeah, and I think we give carers confidence, don't we? And helping them to try and balance, we balance the needs of the person, the family, other healthcare professionals. So it is a balance, but I think we do give carers an awful lot of confidence to keep on doing what they're doing, I think.
And I think also, if the carer is sort of giving you the signs that they're not in that place or ready to talk, it's respecting that also, but not totally ignoring it and perhaps revisiting it at another time.
Because I think from what you were saying as well, Sue, expectations and wishes and choices might not match up with the family, with the person, and you know, that can be a challenge for any health care professional, can't it, when you've got different needs at end of life.
Yes, it can make the situation quite tense and even more stressful, definitely. But again, respecting that everybody has their own unique needs, isn't it? That's the thing.
So what would be your takeaway top tip?
I think my top tip to take away is, it's always helpful if you can to gather information about somebody, whether it be the person with dementia, the person dying, or the family members. Gather information about their previous experiences of death and dying, because that can have quite a huge impact on their reactions and their response in the here and now.
I think my top tip would be to think about how we can support those early conversations so that we can have these conversations with the person who is living with dementia as well is so important. But as I said, you don't have to go A to Z, it can be A to B. I think it's just about thinking where can those seeds be sown? Where can that invitation, that invite into having those discussions, because we have them about living well with dementia, don't we? What support does that person need? What is it about that makes you live well with dementia? But we have to include in those conversations including up to end of life, and that care and treatments in the last phase of that person's life as well, and what matters most to them. So that'd be my top tip. What about you, Debs?
I think I would always make sure that people's understanding has been completely checked out, so that you are starting out, you know, in the right way. But I would also say, let's not forget the carers, although obviously we do focus on the person, you know, the patient, the service user, however the person is described, but let's not forget the family carer, because without them, we would be in a bit more of a challenging situation. So think about the carer, think about their contingency planning, and just check out understanding. And I think we were hoping that people would put in the chat box something that they could take away that might affect their or improve their practice from today's sessions. Thank you.